Hi, this is Dr. Makela. How's everyone doing? I'm sensing a little bit of a lag. I did get a new computer. I don't know if it's lagging a little bit, but it seems to be doing okay. So we're going to try it. Let me know if you're sensing any mouth lag with the speech or if it's looking a little bit slow or anything like that. So, as always, I'm Dr. Janice Makela. I'm a board certified doctor of internal medicine with specialty in geriatric medicine, hospice, and palliative care. And I am here to take your questions. Feel free to put them in the comments. As I've always said, you guys are the co hosts. This is a program for you guys. Put your comments. We'll talk. If you guys just want to say hi, come on in, say hi, welcome. And I will usually start off by talking about a few different topics, but as you guys chime in with questions and thoughts, we'll just take it from there. Excuse me. I'm feeling much better. Thank you guys. I had a bad cold last week. I was not going to be able to do a live stream. Much better now. And then the week before, my computer decided to die. So, again, new computer. I think I got all the settings back up as it should be. But let me know if you're seeing anything weird in the LinkedIn. I'm just going to check to see, make sure that the LinkedIn is up and going here. And yep, looks like we're going. Okay. As usual, there's a little bit of a lag on the LinkedIn. I'll apologize if you ask a question. It might take me a few minutes to get to it if it just pops up. So, anyway, let me just see where we're at here. Turn that down. Okay. So, welcome. Today, I'm going to first just talk about some stuff that was in the news. So, probably the biggest thing that hit the news is that there was some news about autism and Tylenol. I am, as a geriatrician, obviously I don't deal a lot with pediatrics or gynecology, obstetrics. It's not my field. I joke that I went as far away from obstetrics as I could by becoming a hospice doctor. That after doing my peds rotation and my obstetrics rotation, I was like, get me as far away as I can. Yes, end of life, geriatrics, hospice. Only half of a joke. I really did love geriatrics and hospice. So anyway, but that said, it was very interesting in the news, and I actually commented a little bit on it because Tylenol is a very interesting drug. I've mentioned it before, but Tylenol actually works by the endocannabinoid system. Now, for some of you guys who might not know, the endocannabinoid system is a system that is the master system of our body. It actually controls a lot of the other systems. It works with the nerve system, the neurologic system, the cardiac. There, you have endocannabinoid receptors on your heart, on your blood vessels, in your pancreas, specifically on the islet cells that are responsible for insulin, in your liver, in your nerve cells, in the pain pathways. They also speak to the inflammatory pathways, like the cyclooxygenase systems. Even though they're not part of it, there's a feedback between the two of them. There's also your immune system has endocannabinoid receptors on them. your um, fat cells have it. So it is very, very tied to our body, and it's tied to neural development. So this is one of the reasons I personally believe that if you're a teenager, you should not be using cannabis, even well into your early 20s, because that pruning, that brain development that happens in the late teens, early 20s is regulated by the endocannabinoid system. So it makes sense to me anyway that if you take cannabis and you have a nervous system, thing in your brain that's controlled by your body's natural cannabinoids, that there are things that are going to mess that up. So, and one of them is going to be cannabis. So that's why I say that, but I think it is fair to say that neural development in a baby can also be affected by things that mess up the endocannabinoid system. I mean, we now tell mothers to make sure they're getting enough omega 3. And what is omega 3 but an endocannabinoid? So, omega 3, well, it's as omega 6, as you remember, becomes an endocannabinoid. So that's a lot of your seed oils and stuff become endocannabinoids. And omega 3 fish oil modulates it and kind of balances it out and makes sure that its effect isn't too strong. And so we know that in the Mediterranean diet and just a general healthy diet, to have fish twice a week, especially fatty fish that's full of omega 3s, is very good for your health. It's also very good for pregnant women, though, we talk about the risk of mercury and the benefit of omega 3 versus the risk of mercury in pregnant women. And you want to talk to your gynae about that and make sure that if you're sourcing your fish, you're getting it from a source that doesn't have a lot of mercury in it. So we know omega 3 is actually very protective and is actually very good for the brain development. In fact, even 20 years ago, almost 20 years ago, not quite, when I had my first baby, they were telling me to take fish oil. So the fish oil is well established as something, and it works via the endocannabinoid system by balancing the excesses of the endocannabinoid system, perhaps, or keep modulating it. It also is perhaps involved a lot in neural development. Again, why we tell pregnant women to take it, why I took it when I was a kid, and why we still tell people, hey, fish oil is good for you. The interestingly enough about that, just a little tangent off that, another article just came out recently suggesting that fish oil, not fish oil, but the Mediterranean diet, which includes eating 2 fatty fishes a week. So again, that same sort of recommendation has actually been shown to help with Alzheimer's, which I think is pretty cool. So hopefully it's not glitching. I'm not sure if you just saw a glitch or not. It seems like there's a little bit with my camera or something. I'll have to keep an eye on that. Anyway, so what I was going to say about that is that the fish oil and the omega 3 is good for you. The omega 6, maybe not as much, it's not like as evil as people are like, ooh, oil's bad. No, it's probably okay in moderation. But again, there's a little bit of a balance, right? That said, we know then that omega 3 is good and it can help a baby development. And We therefore can extrapolate that the endocannabinoid system plays a role in development and fetal development. In fact, we don't need to extrapolate that. That's established, especially neurodevelopment. The question is, does Tylenol have enough of an effect? We know that Tylenol plays a role in the endocannabinoid system. We know it gets converted to AM404 and in the brain stimulates the TRPV1 and then the CB1 receptor. So it stimulates the endocannabinoid system in its pathway of blocking pain. And then there's actually some new pathways that they're discovering that indeed it may increase or modulate some of the other endocannabinoids in different ways. So we know that it does that. Now, is what it does to the endocannabinoid system and what's bad for babies, is that the same thing? I don't know. I'm just saying it's worth looking into. Now, the role of the endocannabinoid system and Tylenol. Now, this is a little bit different. I'm talking about the theoretical, saying we know the endocannabinoid system does these things. We know Tylenol does these things, but does A plus B equal C? I don't know. There's two articles. That's why we do studies. That's why we do big population studies, because sometimes the stuff in the test tube that I'm describing, right? Sometimes these mechanisms don't actually hold up in actual human studies because the body is a lot more complex. And so we might look in a test tube and a couple neurons here and say, yes, this is how it works. But later on down the road, we find that no, because this other pathway modulates it and this does this, and this whole interconnection actually creates a different answer. So Tylenol may have a mechanism of action to create autism in the brain because it could affect neural development, but it also might not. And when you look at the human studies, there's two human studies that everyone is citing right now. The one that JFK Jr. is citing is not really a study. It's a review. It's a meta-analysis. It's not even a meta-analysis, because a meta-analysis is a very specific thing where you take everything and you pool it together and you try to get an answer. But the I'll get you a question. Yes. But I'll just finish what I was going to say on this. So the meta-analysis isn't quite a whole it wasn't a meta-analysis. I'm sorry, I got interrupted. It wasn't a meta-analysis. It was a review. It was looking at all the different cases and it kind of saying, this one says this one says this one says this, and showing that, yes, the preponderance of studies that have been done about maternal use of Tylenol in autism favors the fact that autism may be associated, so not necessarily caused, but associated with Tylenol use. Now, it's interesting because there was another study that came out several months before, and it was a very big Swedish study, and it looked at a database of 2 million people, 2 million moms, and it said that, yes, there was a little bit of a finding, but when you accounted for sibling effects, that is, things that might account for like what people grew up in the same household, had the same genetic risk factors, whatnot, when you took that out, there was no longer a finding. And you're hearing a lot of people cite that one. Now, what I found kind of interesting is doctors trash talk to each other, scientists, because the first half of the discussion of this review article, the one that said, yes, there's definitely an association, is all about the weaknesses of the Swedish study. that said there wasn't one. And their biggest criticism, and I'm actually throwing this past a friend of mine who's a statistician and saying, hey, can you look at this? And he does biostats, looks at reviews and helps develop studies. So I'm like, read this for me, translate it. I'm waiting to hear back from him. If I find out next week from him, I'll let you know. But their criticisms were that when you took out just the groups of people who had siblings to compare, that were compared, that instead of 2 million, it was like 300. And that it wasn't a big enough of a data point, or maybe they said 30. I have to look back at it again. But the point was, they were saying that the data was not big enough to be worthwhile, and that, yeah, everyone's saying 2 million, but it was really just a small people that they were able to do the sibling analysis, and it really was just barely statistically significant and not really important. So they spent like half of their discussion on their study talking about why the other study was wrong. So there's a little bit of debate within the literature. Now, the second problem, so the first issue, is that the literature doesn't agree with each other, and there's a big debate with it. The second, and then the other issue is, well, what does this mean clinically? Well, the first thing is there are not a lot of great drugs. Ibuprofen is very bad, very, very bad when you're pregnant, especially in the third trimester. Steroids, not great. Excuse me. All of these things that we would use to control pain. Opioids. Obviously, we do not want babies with a bunch of opioids in them. Again, if we can avoid that, right? So cannabis, again. So there's a lot of the things we would talk about for pain. Tylenol is one of the few that when we've looked at a large number of people, we're like, yeah, it's safe. That's what we've been saying. And there's not a lot of good options. So if a woman does have a lot of really bad pain, and more importantly, fever, I think one of the biggest concerns I've heard from colleagues in this field is, what are you going to do about fever? And I got to think they have a point. If you have a fever, that can be catastrophically bad for the mama and the baby, especially if you have unremitting fevers. If you're very, very sick and the fever is getting high, that can create, and God forbid you get a fever so high that you start getting delirium or seizures or something like that. Fevers are really, really bad for a pregnant woman. And so, yeah, and then the other thing that maybe hasn't really been looked at is, it's like, how much are you taking it and at what time is it being taken? So I personally think, one, you should talk to your gynae. And, if you are pregnant and you're wondering, what should I do? Talk to your gynae. Two, I wouldn't panic. The data is out there, but unless you have a condition that you have to take Tylenol every day, all the time, some really bad pain syndrome, you want to talk to your doctor again about that and breathe. Understand there's a lot of hysteria, a lot of news, a lot of people, and this is loaded with politics because it's coming out of HHS, because people with their different opinions about, RFK, and it's kind of, shall we say, people are making opinions based off of who was saying it. So whether you like or don't like what RFK says is often tempering how people are viewing this. Third thing to remember is that this is a preliminary report. This is a leaked report. We may learn more as the final report actually comes out, that it's not as much as everyone's saying. It may just be, oh, I mean, this is a news report, and news reports are about headlines. We don't actually have the final report, and they just might be saying they might actually be doing a fairly measured response of just saying, oh, maybe. But then the leaked report is like Tylenol. Uh, God, as someone working with cannabis, I see that all the time where the newspapers take one little study that's not very well done and say cannabis does this terrible thing. I'm like, wait, no. you know, so take it chill, just relax, talk to your doctor. I do think it makes sense that fever and pain need to be controlled, and I think it makes sense to not panic too much. If you took Tylenol when you were pregnant and you have a child who's autistic, please, for the love of God, do not start blaming yourself and go, "Oh no, I took Tylenol." I don't think it's going to be like that. I think it's more maybe an association, maybe high dose, maybe at certain times. We'll learn more as it goes on, and it may not even be related. Just again, I want to see more endocannabinoid factors controlled for. So the amount of omega-3. One of my concerns about the Swedish study actually is Sweden is a place where people have a lot of fish in their diet compared to America. And so that fish, that omega-3 might be balancing out, might be more than balancing out that effect, right? So don't panic. Talk to your doctor. Do what they say as far that. Understand that this is a preliminary data and it's extremely emotionally charged. You're going to see a lot of talking heads say a lot of different things. Don't worry. And I would ask that people who do research on this look at the endocannabinoid system as part of factors, because things like the amount of fatty acids we eat, like the omega-3, omega-6, the omega-9s, our weight, again, our metabolism might have greater effects than Tylenol. Tylenol may not be that strong of an effect on it. It remains to be seen. Okay, I've gone off quite a bit on that, but now I wanted to just, Natalie had put a little comment, and I wanted to just talk about that. Thanks for the live. Interesting point regarding the developmental pruning. My background, schizophrenia also highlights this pruning stage as critical winding where processing may become dysfunctional. Oh my God, I want to talk to you, Natalie. I actually have an interesting question about that myself for you, increasing the risk of psychosis. It's certainly a stage where cannabis use should be approached with caution. Let me tell you what, I'm going to take this off the screen just because it's a little. Let me throw a question past you, because one of the things I've learned about the endocannabinoid system, we learn about it to study cannabis, right? But it turns out the endocannabinoid system, if we never had cannabis, would still be there, because the number one thing that we consume that affects the endocannabinoids is actually the fats in our body. So omega-3, omega-6, omega-9, they all do different things. Omega-6 actually becomes the endocannabinoids, and then omega-3 and omega-9 modulate it. And why I mention that is because there were some studies about kids with schizophrenia, not schizophrenia yet, but at risk of schizophrenia, who were taking omega-3 fish oil supplements, and it was actually decreasing their chances of getting psychosis later on down the road, especially in people who had certain genes that made them prone to schizophrenia, and they found some of those genes were associated with omega-3 processing. And the thought was that the omega-3 processing getting messed up was affecting the pruning and then leading to schizophrenia. And so exactly what you were saying. I was reading about this. And the question I have wondered, because I personally think that cannabis psychosis is exactly related to that. I think it makes sense to me. And of course, there might be different people and there's different, but it makes sense to me that there are people with different risk levels. And so, someone at high risk, there might be someone who's just a little bit above high risk. There's someone who's going to get schizophrenia, someone who maybe isn't schizophrenic, but just a little bit off. And then you get someone who doesn't have any symptoms. And that person who's at risk but never got symptoms, I think that person is the one at most risk for schizophrenia. If they take cannabis, they're fine. They take cannabis and now they're schizophrenic. That's my theory. Obviously, I'm not a peds, I'm not a psych. I can't say that for sure. But based on the literature I've been reading, it seems to suggest that that seems related. The question is the question to me is if you took kids with cannabis use disorder or kids who started to get psychosis after using cannabis and you gave them omega-3 fish oil as part of their treatment, would they get better? And just full disclaimer, I do not own a supplement company. I don't sell fish oil. It's just really a question because we know that omega-3 goes to balance the endocannabinoid system and calm it down a little bit, whereas with schizophrenia, it might be a little bit too elevated at this part. So if you gave omega-3 fish oil to kids who were diagnosed with cannabis use disorder and not stopping taking it, and they were still, if you gave it at the point of diagnosis and said, okay, you have cannabis, I want you to take this while we work on getting you off of it, or you had people who already had psychosis and you gave it to them as part of their treatment, would they get better faster? I would love your opinion on that. Excuse me, a little bit of itchy nose there. So, yeah, fascinating question. Thank you, Natalie, for sharing that. And if anyone is a pediatric or psychiatrist, psychologist, and wants to talk further about that, I would love to, because I can't do that study. I am, like as I mentioned, way on the other end. I am a geriatric and hospice doctor. So stuff with pediatrics and kids and psychiatry is out of my scope. I couldn't do the study if I wanted to. But I think it'd be interesting, and I think it might help people. Quick answer. I believe so. Huh, awesome. I would love to talk to you and just kind of reach out to me. Let's talk because I can't do anything about it on myself, but I would love to see that done just for the simple fact that it might help people. Less antipsychotics, maybe a better recovery. So, yeah. Let's see. So, yeah, I always talk about so, yeah. Now maybe we go talk a little bit on the other end of life here. Geriatrics, my specialty. I had a post this past week where I was talking about my Dr. House movements. If you guys have ever watched Dr. House on the TV show, he always comes out, he's given these impossible cases, and then he does crazy things. Oh, add CBD2. I'm just going to address that real quick because that is a great point. Again, a little bit of a lag here, so I apologize. Add CBD2. Yes, There's actually one study. It's odd that there's not a lot of them, but there was one study that actually compared. Oh, was it? Is one of the second generational antipsychotic medications. Wasn't quetiapine. Zyprexa, I think. I think it was Zyprexa. I forget, but it was one of the atypical antipsych meds, and they compared it head to head in schizophrenia versus high dose. It's like 600 milligrams, so decent high dose of schizophrenia for treatment of someone with an active schizophrenic attack, with active psychosis. And they found it worked as well with less side effects. Oddly enough, I haven't seen a lot of studies after that. You would think something like that would be like, oh my gosh, let's do a whole bunch more studies. But no one's paying for CBD to be done, right? So no one's paying for a CBD study. But yeah, again, CBD does a similar thing. CBD does not activate on the CB1 receptors, the CB1 and CB2 receptors like THC. It actually activates on other receptors, and actually affects how the THC binds to those receptors. And that's why it's been sort of a folk. I'm going to call it folk instead of bro cannabis, because I think that's a little mean to say that. There have been over the decades people who have used cannabis and worked with it, who have developed some understanding of it that isn't based in our science studies. And some of it, is sort of like folk medicine. It turns out that, yes, sometimes folk medicine is real. A classic example is 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 nausea and the smelling of isopropyl alcohol. Don't take a big whiff, but it was a classic um, grandmother's recommendation in Mexico, right? To smell a little bit of ibuprofen and ibuprofen, isopropyl alcohol, my tongue tied there. Smell a little bit of isopropyl alcohol, and it would help get the nausea better. They actually did a randomized controlled trial and found out, yeah, it actually works. It's now something, you can suggest to at least, before people start taking pills for like mild nausea. Now, but yeah, so CBD for the longest time in this kind of collective knowledge of the history of people using it, they have said that if you get a lot of hallucinations and paranoia when you use THC, that you need to increase the amount of CBD you're using, use a strain with more CBD in it, and that would calm it down. And it does seem to be the case that the way it works on that is it does kind of do some antipsychotic things. So to then see that there's studies to show that even in schizophrenia, CBD can help makes sense. It's all kind of, yeah. Now, let's see, got a few more things. Oh, I got Allison commenting, but before, let me just get to Natalie's next statement real quick, since it was her conversation. We'll come back to Allison in a second here. There's some early risk psychosis studies. Oh, awesome. Australia and the UK. I am waiting with bated breath, because I do think it makes some sense that CBD, I know. So those are like people like what they were doing with the omega-3. And again, it makes sense. Omega-3 and CBD are both things that kind of calm some of that effect. Maybe a nice combination. Wouldn't be surprised if someone patents a combo pill, right? I should keep my mouth shut and just do that, right? But that's not, yeah. Okay, so you've been taking omega-3 and omega-6. Cannabis does not cause psychosis. No. Well, we'll get to that. So I've been taking omega-3 and omega-6 in a 3-to-1 ratio for over 30 years. We have known this for decades. Oh, well, thank you. Yes. So there is some thoughts about that, the 3 to 6. This is a trust me when I say I've had like debates and stuff with cardiologists versus some of the ECS researchers I've known about whether or not the 3 to 6 ratio means anything. For some time, there had been some thought that omega-3 to 6 ratio, that the American diet was actually 1 to 25, that we had so much vegetable oils and stuff, and not enough fish oil in our diet, and not enough flaxseed and healthy omega-3 sources versus omega-6 sources, that this balance was throwing our metabolism out of whack. And this was causing heart disease, diabetes, vascular disease, all sorts of stuff. And recently, there were some human trials that suggested that this did not bear out, that this ratio didn't matter. Now, there's some criticisms of the human trials saying, they didn't look at this, they didn't look at that. And so right now, what I can say with a great deal of certainty is omega-3 is great for you. And omega-6, maybe not a lot of it. There does seem to be some, evidence that it's not great. Our body should be taking it, historically has taken it at a ratio of 1 to 4 or 1 to 1. And again, we're like 1 to 25 in the American diet. That does seem to be a little bit out of whack. And I think what this suggests is heavily processed foods that have a lot of these. You should avoid heavily processed foods anyway. And if it turns out that it's the omega-6 seed oils in there that's doing it, more power to you, because the processed foods are just going to be bad for you anyway. Mm-hmm. Now, but yes. Now, I know Allison was here saying that cannabis doesn't cause psychosis. I think there's an interaction at people who are at risk chemically during a certain age period between like the late teens and early 20s, where you might be tipped over. Also, what I was talking about is that there are some people who feel very paranoid and do get a little bit out of sorts when they take higher THC doses, and taking CBD seems to help that. Now, I know there's a huge debate about the origin of whether cannabis psychosis is, a lot of people feel strongly that it's not the cannabis that's causing it in teenagers. Rather, it's schizophrenia that makes them more likely to seek cannabis. And so it's an association and a comorbidity of schizophrenia as opposed to a cause. And I will grant you, it hasn't been proven as a cause. But I tell my kids this, that I don't want them smoking it until, if they're going to smoke it, till at least their, mid-20s. The other thing is that to realize, sorry, a little itchy there. The other thing, so I understand that this isn't the final word. That's kind of how I view it. And personally, I think the other thing is that, a lot of people who have been older, who again kind of grew up smoking, using stuff like that, and are like, no, it doesn't, I took it when I was 14. The dosages and the THC percentages versus the CBD percentages, of what people are taking, what the kids are getting, not to mention God knows where they're getting it, because since the dispensaries are age gated, they might be getting it from a less respectable source that might be tainting it, or they might be getting like the Delta 8 where it's all THC and no CBD, right? They could be getting, um, they might be getting dosages that aren't great. Now, and then whereas someone my age, people who used it back then, in their teens, were taking THC amounts that were much, much smaller. The weed itself was much weaker at the time. Of course, people were probably smoking a whole joint as opposed to just now. Some people only being able to smoke a puff. But the point just being, I respect the fact that it's not fully answered, but I don't want teenagers using it. Cannabis may perpetuate an underlying predisposition for those with, yeah, right. That's kind of what I think too. I agree. And I think that's kind of what we're saying there is that I don't think cannabis is causing the psychosis. I think there's people who are at risk factors, and it's a bit of a Russian roulette because we don't have good genetic testing, and plus no pediatrician is going to do a genetic test where they say, well, let me test to see if you're at risk of cannabis psychosis, because if you're not, you can have cannabis. No one's going to do that. It's probably going to be something like, but there are people at risk, and I'm a little bit concerned that there's people who are asymptomatic, who don't have symptoms, who are in a higher risk group, but never quite tipped over into symptomatic, that those people are maybe what we might be seeing a little bit with an increased amount. And then there's going to be people who have no risk and they can smoke and they're fine. Then they don't get psychosis. So yeah, I agree with Natalie there. That it underlying predisposition for people with varying, it's by itself, it's not causing it. I agree both with Allison and Natalie in that statement there. Now, omega-6 to omega-3, 3 to 1. Scientists told me I'd be walking at this age if I took this decades ago. They were right. Oh, I know you've been very open in the past about your health issues and how various different things. And it's interesting. This is, again, one of these things that's very heavily debated. I've talked to a lot of people who research the endocannabinoid system, and one in particular in Sweden, Dr. Bracelet tells me a lot about the 3 to 1, and particularly he thinks that the 6, that the 6 is too excessive in our diet, and that's what's leading to a lot of our bad health outcomes, because we have endocannabinoid receptors on our blood vessels, and cardiovascular problems and stuff like that might be from the 6. Heck, no real studies about autism in that, but but then I talked to some cardiologists, and again, they cite these human studies and say, no, based on the human studies, that doesn't seem to bear out. But then I know I actually had a really interesting conversation with a cardiologist and Dr. Bracelet and me all in the same string. And Dr. Bracelet was about, well, yes, but they didn't look at this and they didn't take out this subset. He's like, you're right, when they looked at this so there could be, again, some genetic predispositions, some other things that could be throwing the data off. It's kind of interesting. Again, we don't research the endocannabinoid system enough. And because of that, we don't have a lot of great solid answers. And now, the one thing I will say, frankly, if you want to replace all your canola oil, all your vegetable oil with olive oil, and if you want to replace that with olive oil and avocado oil, because olive oil and avocado oil are omega-9 fatty acids, and so they're going to be very healthy. Adding in flaxseed to your diet, which is full of omega-3s, hemp seed, full of omega-3, um, fish oil, of course. All of those, if you want to add those into your diet, that's a rational thing. You say, hey, I'm going to eat less processed food. In fact, all of this talk about omega-3 and omega-6 balance is really um, all that omega-3 and omega-6 in our diet and omega-9 and all this talk is really just the basis for the Mediterranean diet. Whole foods, avocado or olive oil, fish oil, take fish twice a week. That's the Mediterranean diet. It's the DASH diet. It's like all of these evidence-based diets that are good for your heart, especially the Mediterranean diet, are really based off of this concept. So if you say, yeah, this makes sense, I want to eat less omega-6 in my diet, embrace the Mediterranean diet and eat less processed foods, eat more whole foods, eat more whole grains, eat more fish, and you'll be healthier. Excuse me. But if the one issue I have, and like with the seed oil people, right? The ones who are like, oh, all seed oils are bad. First of all, they're not all bad. Hemp seed is great. Flaxseed is great. Also, canola. It's a ratio, right? So when you look at how much is in each of them, canola has less omega-6 than certain vegetable oils. So those are all kind of balanced, so it's not as bad, but maybe not as great. You say, okay, I don't want those. The thing that drives me nuts is the people who say, no, I don't want to eat seed oils. Great, I'm okay. Eat avocado oil. I'm going to eat beef tallow. I'm sorry. The people who are telling you that beef tallow is a safer alternative than vegetable oils are people trying to sell you beef tallow. Or they are sponsored by the beef industry. I've been seeing YouTube. It's all over YouTube. People are, oh, let me tell you about the evils of vegetable oil. And when you look at them, they're selling you beef. Buy my beef. And I'm like, no, beef, the saturated fats, just because omega-6 may not be great for you, doesn't make saturated fats any better. You can't just say this is bad, therefore this other thing that we thought was bad forever is suddenly good. That's not how it works. So, thank you. Appreciate it. That's very sweet. Allison, that's great. If you have psychosis, beware. Yeah. THC of hydrocannabis is 5 times right. Exactly. And so there's actually some studies now that are suggesting that you can actually get lower TH content and a better effect if you get stuff with more terpenes in it. And that's what she's talking about, is these landrace strains that have more balanced terpenes. And so there's actually, in the cannabis world, a little bit of debate as to whether the greenhouse grown or the sun grown has a better effect. And I think it really depends what you're trying to use it for. If you need something exactly the same every time, greenhouse might be a little bit more stable. But the sun grown, maybe because the UV does break down some of the cannabinoids to make some of the other cannabinoids and some of the terpenes and everything, plus the UV, a lot of the terpenes are actually natural sunscreens. So the UV probably induces the creation of more terpenes. we see this in vegetables. When you have cauliflower, if you want your cauliflower to be white, you have to blanch it. You actually have to cover it with leaves to keep the UV light off of it. If you take the light off of it, if you let the leaves, your cauliflower is going to actually be a little bit yellow. So UV light will affect how plants produce things. And because they'll sometimes create chemicals that will be more sunscreen. In fact, purple cauliflower, same idea, right? And so the according to top scientists, you have to have a 3-to-1 ratio. Again, I won't actually argue you too much on that because, again, the ECS scientists that I know will say that too. Um, and but again, the human data isn't showing that. But again, I'm not going to fault anyone for saying, let's stop with the processed foods that are heavy in these vegetable oils, with these omega-6 vegetable oils, you know. So yeah, no, I actually have significantly cut down the amount of canola I use, and I tend to use avocado oil for heavy deep frying stuff if I do anything heavy deep frying occasionally, and olive oil for just sauteing. Though I have discovered I really do like what avocado oil does to eggs. It seems to not stick to my pan as well when I use avocado oil. So, yes. Entourage, right? Exactly. The THC percent, she's referring to the fact that, yeah, in my generation, I'm in my 50s, the THC that my friends would have smoked. And I'm a bit of a geek. I didn't, but my friends who did, um, they were using just a fraction, of what today's percentages are. The stuff that people can now buy are much, much stronger because the companies are breeding a much stronger percentage. But what's interesting and what she talked about earlier was that there is there's actually some data coming out to suggest that you don't need such a high THC percentage. You can actually have a lower THC percentage and, excuse me again, get a similar effect if you have some terpenes in them, if you have the entourage effect. And the entourage effect is this idea that the plant itself as a whole has a stronger effect than just the THC itself. That the THC is one thing, but the plant itself has 140 other cannabinoids. And so that 140 other cannabinoids all interact. In fact, that's why you get strain differences, is because the differences in terpenes. And again, terpenes are the things that give the flavor, the smell. It's what gives the flower its smell. Some of the terpenes are things that you're going to see in other plants. Like I often talk about pinene because one of my favorite smells, rosemary, is full of pinene. Right? Pine, of course, has pinene. So that kind of smell. So if you have rosemary and pinene, that kind of sensation. And then there's limonene, which has lemon kind of over things. So those terps all play together. And so those terpenes play together, the cannabinoids play together, and combined with the THC, all create these different strain differences. And so all of these different effects can be from these different, strains. In fact, even as we get into like the sciencey end of it, right? I'm assuming you're talking about the pinene. Again, a little bit of a lag here for the typing and the talking. I apologize. LinkedIn does that. They purposely put like a 30-second lag and it's sometimes up to a minute and a half to to help with their end of the streaming, which is annoying when I'm trying to do a live stream like this. So people comment in about 2 minutes after I've said something. So I'm assuming you were talking about the pinene when you say very anti-inflammatory. Yeah, I was reading a couple interesting studies on the pinene, and like it even helped wounds heal better. And this was like rosemary extracted pinene, so they were able to. So, yeah, it's very interesting what some of these terpenes can do. And so, and we actually have some studies on some of these terpenes because, like I said, some of them actually come from the herbal world. Limonene from all your citrusy fruits, and pinene again from a lot of the pine based sort of smell. My marigolds have terpenes in them. I'm not sure if they're in any of the same that a cannabis does, but again, anything that has a really pungent, strong floral smell is going to be a terpene. And so the terpenes have biologic effects, the cannabinoids. And so there's a lot of different cannabinoids. There's, everyone knows about CBD, which is, it doesn't get you high, but it modulates THC. It also might have some anti-inflammatory effects, maybe has some pain. There's some recent studies about it topically helping neuropathic pain. So of course we know that the very, very high dose CBD helps with seizures. And back to that entourage effect, I know the Charlotte Web people often talk about it, that because they make a extract of CBD with just what they call full spectrum, which means there's just a trace amount of THC. And they use it for autism and for seizures in pediatric cases. And they use a tiny amount. And the idea is that just that tiny little amount means you don't need as much CBD as the Epidiolex does. So again, that entourage effect where they all kind of play together to have a stronger effect. So, but this is one of the things that makes it so hard from a medical standpoint, is because in medicine, we're so used to taking that one little drug, things that have been used for centuries, by tribal groups like willow bark, right? And we said, wow, what makes willow bark so great? And then you extract aspirin from it, or Taxol from the yew tree, right? Turns out to be a chemotherapy drug for breast cancer. And so in history, we've always just taken out the active component and used it, and then we can test it. It's very, very rare that we can take that our system of healthcare, our model of medications, lets us take a whole extract because, well, a lot of the problem is exactly what we just talked about, where you get these strains variations. So you can't just say cannabis does this. It's like, well, but what if it has more of this and less of that and less of this? And does it still have the same effect reliably? And it may not. That's why you're seeing a lot of people do IPs with the strains, especially as they're anticipating medical change. You're getting people who are making IPs with higher amounts of this cannabinoid or this terpene or this or that. And so, yeah, we're seeing that. It's kind of interesting. Hey, it is almost 8 o'clock. I will be wrapping up. Anyone else with questions? This was a great conversation. Thank you guys for all chiming in. Oh my, I'm so glad so many people came in today and we had such a lovely conversation. Oh, you see, we're probably about 2 minutes behind. I just mentioned that. I bet the actual willow bark is better than aspirin because it's got more compounds. right? And that's it, is that cannabis is hard to um, isolate. And when you do isolate it, you may not be getting all the benefits of it. Um, it remains to be seen. There are far less drug interactions with full spectrum CBD compared to many high dose isolates for seizure control. Um, Bonnie Goldstein work in epilepsy shows much better symptom control with full spectrum, right? And I mean, and that's again the whole Charlotte's Web thing. I know they're trying to get FDA approval. I'm good for them. I hope they do. You know, but but they had to go through a different pathway and they had to do a whole bunch of other cannabinoids to show the safety of all of them to get the FDA even as far as I think they're in a phase 2 trials. Oh, yeah, definitely love to talk to you more, Natalie. This was fabulous. I I really appreciate the conversation. I always tell people that the chat is you guys are the co-star. I'm not a podcast. I don't bring on guests to say, "Oh, let's talk," and then we're just two talking heads and everyone else watches. I actually kind of took a cue from the Gen Z Twitch folks here. And to me, the chat is the star. I'm here to answer your questions and to talk with you guys. And that's kind of how I really like it best. I can certainly talk forever if I need to, but it's so much more fun having a conversation with people. So, no need to apologize. This is great. Thank you guys so much for coming. I am going to wrap things up here. As I mentioned, I'm Dr. Makela. Um, One thing I am doing is I will be creating programs for doctors specifically. So if you guys know any doctors, let them know. If you have any docs who need to know about the endocannabinoid system or need to know a little bit more about medical cannabis, or you talk to your doc and they're like, I really need to know more about that, give them my info. I am creating courses, training programs, actually personalized training programs for physicians to educate them about cannabis, especially as there's talk about rescheduling, especially as more and more people are using it, as it becomes more and more legal. Doctors never got this training in medical school. It's not their fault. We just got told, oh, it's illegal. Now we need to know. Now we know it's a drug. We need to know how to use it. And we need to know how to approach people who are using it beyond going tisk tisk, don't use it. So, yes, if you know any doctors, if you're our doctor and want to know more, reach out. If you have doctors feel free to send them my info. I will be starting these lectures. Look forward to talking to everyone next week. God willing, assuming we don't have more computer problems or I don't get another cold, I'll see everyone next Thursday evening. You guys all have a great evening. Thank you so much.